So the NOBILITY study was a phase 2 trial where we compared standard of care plus placebo, standard of care being mycophenolate mofetil plus corticosteroids, with mycophenolate mofetil, corticosteroids, and obinutuzumab. And the doses that were given were at the beginning, 2 doses 2 weeks apart, and then at 6 months. And what the primary endpoint was complete renal response, and a very rigorous complete renal response with proteinuria less than 500 milligrams a day, and creatinine could be no more than 15% higher than the patient's baseline when they entered the study, and it had to be under the upper limit of normal. And with that, we were able to show a significant difference at 52 weeks in complete renal response in favor of the obinutuzumab group versus the placebo group. What's really important to understand, in my opinion, is that the trial was designed to go for 2 years, and what we did was we did have the 76-week data, and at that point the patients, again in the obinutuzumab group, were statistically more likely to have had a complete renal response, and the difference now between placebo and treated patients with the drug was about 20%. So we're seeing over time an increase in the complete renal response in the obinutuzumab group. If you actually plot the kinetics of response of the 2 drugs, you see that it plateaus in the placebo group, and even at week 76 there's still an upward slope in the obinutuzumab group. My expectation is that because this is a long-acting drug and the B cells are involved in the autoimmune process, as we keep B cells sort of attenuated, that we really not only have induced remission, but we're going to maintain remission over a longer period of time. My prediction is that when we have the 104-week data, which will be in the next couple months, I hope, continue to see a rise in complete responses in the OB group, and my assumption is these are going to be patients who hadn't quite responded or had been partial responders converting to complete response, and then either a plateau or continued decline in the patients who receive placebo as they tend to relapse. And so we'll see when those data become available. But that's really, to me, the important take-home message from this study.